Okay, hello everybody. We are live. My name is Joe Kita. I'm the editor of the Fresno Bee, and I'm here today with an esteemed group of guests here. And what we're going to talk about today is the coronavirus and how it's impacting the central San Joaquin Valley. So let me first start out by introducing our guests. We have with us today State Senator Andreas Borges, Assembly Member Joaquin Arambula, Fresno State President Joseph I. Castro, Fresno City College President Carol Goldsmith, and Clovis Unified Superintendent Emer O'Farrell. So thank you all for joining us, and I thank all of you for taking time. I know you're all very busy, and I also know that this is a really important issue. Obviously, it's affected all of our lives, and we're all very concerned about the coronavirus. So I wanted to start out right now with a quick question that would kind of open things up, and please jump in if you have anything to say, if you want to follow up what another person, a member of our panel is asking. So let's start out here with this question. What is your biggest concern with the coronavirus pandemic right now? And we'll start out with Senator Borges.
Thank you, Joe, and the Fresno Bee, and everyone who's tuning into this live stream. These are certainly unprecedented times. So I think to answer your question, what are things that we can learn from this pandemic and things that were unexpected? I know that nobody anticipated the full breadth of this virus, and we also certainly could not have anticipated. These are certainly. Oh, I think we have some new chime-ins here. Joe, do you want me to wait, or do you want me to continue chatting?
No, keep going. If you're not talking, please put yourself on mute, and I'll try to do that as well.
All right. Well, to answer your question, one of the concerns that I have is the precaution fatigue that is going to come about. I think after the initial shock and awe of learning about the virus and its devastating impacts, and in many instances, it's dismantling our way of life, we're having to adjust to that. What concerns me is not only what we have to go through as our way of life has changed, but also the precaution fatigue. At some point, now that schools are closed and people are staying at home, at some point they're going to want to, break out, if you will, and undo some of the work that's been done in California. And that, I think, is of grave concern, because we need to look at this virus. And I do not have a medical background, let me be very clear, or a public health background. But as I've been briefed by those who have, I've learned that it's going to likely go through various stages, and we're in phase 1 right now of that stage. There's theories out there that in the warmer months, we could see the numbers flatten and dip down, but doesn't mean that it's not going to come back in a phase 2 and possibly beyond. So I think as long as we understand that this is a way of life for a period of time, and if we front load the difficulties that we have to shoulder right now, it will make it better than having to backload it with a prolonged way of life down the road. So as long as we are mindful of what the public health and safety experts say, and we act accordingly, that is our best course of action.
Excellent, thank you. Okay, next let's go to Dr. Arambula, Assemblyman Arambula.
And I too want to thank the Fresno Bee for hosting this town hall, as well as my colleague, State Senator Andreas Borges, as well as the higher education leaders. But in the Assembly, we actually have time limits and we answer questions. And so I don't mean to push my state senator, but I think the question was about our biggest fear right now. And if I can tell you my biggest fear and be transparent about it, it's one that I think many of our frontline workers are fearful of right now. Just a few days ago, our governor actually signed an executive order, an order that established healthcore.ca.gov, a website that will allow people just like me and 35,000 other Californians who did sign up onto healthcore.ca.gov are figuring out how we can get back in and help on our front lines. Now, my fear, along with those who are on the front lines now, would be whether I bring that virus then home to my young family. And I think it would be remiss for us not to take a moment to actually thank those who are on the front lines now, who are sacrificing themselves for our communities, as we owe them a debt of gratitude and appreciation for that sacrifice and service for our community.
Thank you, Dr. Arambula. Let's now go to Dr. Castro, Fresno State President. And the question again is, what is your biggest concern with the coronavirus pandemic right now, especially how it affects higher education?
Thank you, Joe, and thanks for the invitation today. I think my biggest concern is for the health and safety of our community and making sure that we do everything we can to keep as many people safe and healthy as possible. And from the Fresno State perspective, of course, I'm very concerned about the health and safety of everybody connected to our university. And that's why we took steps to ensure that folks were safe as we move to virtual education. I'll talk more about that later. And so far, no cases have impacted us, thankfully. My secondary concern is to make sure that our students continue to succeed and our faculty continue to thrive in the classroom very differently than ever before. But I want to make sure that those 6,000 plus Fresno State students graduate as planned in May, and we'll celebrate when it's safe. So those are the things that I think about as we navigate these extraordinary days here.
Thank you, Dr. Castro. Now let's go to Dr. Goldsmith, President of Fresno City College.
Thank you, Joe, and thanks to the Fresno Bee for having this very important conversation. Very similarly to my other two esteemed colleagues who just spoke, I'm concerned about the complacency of all of us as we go through this first phase. You know, my job as an educator is to make sure that we migrated safely and swiftly into an online remote environment. And we've done that, and I'll talk a little bit more about that later. But the health and safety of our community is always at the forefront. And, you know, Fresno City College has the honor of being the California's largest nursing program. And right now I have 110 students who are ready to graduate in May. And so we're working with the legislators and the Board of Registered Nursing to get those students on the front lines, but also to make sure that they will be safe and that this experience that they're going to have on the front lines of this virus will count towards their graduation requirements. So I'm really concerned about continuing our efforts to prepare the first responders, both police, fire, respiratory care. Those activities must continue, as we know our workforce across the state and across the nation will become fatigued in the coming months. So I'm really concerned that we're able to continue to do that.
Thank you, Dr. Goldsmith. Next, we'll go to Dr. O'Farrell, Emer O'Farrell. She's the superintendent of the Clovis Unified School District, and obviously this is a huge impact on K-12 education. So Dr. O'Farrell, again, the question is, what's your biggest concern with the coronavirus pandemic right now?
Well, good evening, Joe, and thank you for including Clovis Unified in this conversation. You know, not unlike my colleagues, the safety and well-being of all 43,000 of our students, our 6,000 employees and all of their families is of utmost importance to us. What I will tell you has been a major concern for us over the past 3 weeks since we commenced distance learning, and now as we embark on the next 3 weeks, we have extended our suspension of on-site classes until May 1st, is, you know, when we talk about the health and the well-being, the safety of our kids, we're talking about young children whose world has been turned upside down. Not all of our children are in homes where their parents are there during the day. We have many of our children, their parents are in the healthcare industry, and you know, just providing not only the academic support for our kids, but also providing support for their social and emotional well-being is very critical for us. And I will just tell you, as a superintendent, I have endeavor to stay extremely positive, because our kids are looking to their teachers and their superintendents. And if we remain positive as the adults in their lives, I do feel that the mental and social emotional well-being of our kids will contribute greatly to helping them stay the course academically.
So thank you, Dr. O'Farrell. So next I'd like to introduce Tad Weber. Tad is our editorial and opinions editor at the Bee, and he's going to ask the next question. So Tad, take it from here.
Okay, thanks, Joe. So this is a question for our state legislators. And it starts with a sober note. As of this morning, there were more than 200 dead in California and more than 10,000 cases of coronavirus. So two-part question for our state legislators. First of all, how do you grade state and local efforts so far to deal with the pandemic? And then second, what's the main thing you want done in your districts right now?
Maybe I'll jump first on this if we can, and then we'll do the senator. I think we as a state have done a great job of preparing for this pandemic and helping us to start to bend the curve, but must admit that it's early on in the process of this pandemic, and much more work does need to be done. The second half of your question is really regarding what needs to be done right now. And I would really look towards surge capacity and surge personnel or workforce development, the issues that will be facing us over the next few days, if not weeks. And my concern would be the recent reporting that has been done by the Fresno Bee in Manuela Tobias, where she is talking about the Federal Department of Defense and a medical station that will not be full size, that will not have the surge capacity that the other sites will have because, as she reports, we don't have the staffing. And that to me is something that I can immerse myself in and figure out how I can be helpful. Tomorrow morning, I have a call with Cal OES. They're the Office of Emergency Service, our local liaison, to figure out how I can work with them to be creative. The governor recently had an executive order on workforce, and I am the Assembly's and the Speaker's liaison to the governor's office on both workforce development and surge capacity. So I intend to engage with the administration in figuring out how we can reach our goals of 50,000 beds for the state of California, but also make sure that all regions of our state are able to deal with the surge that is incoming.
Thank you. Senator Borges?
Thank you, Chad. And thank you to my esteemed colleague from the Assembly for the work that he does, especially in medical capacity, given his background. I would say that the state of California is actually doing quite well. There's obviously shortcomings and there's obviously strengths. I think one thing that cannot be overstated is we could have learned a lot more from China as they experienced what they went through if they were more forthcoming with the information. But given that we were not in that situation, we had to act swiftly. And I'll give the governor credit for taking very decisive action early on. I know there was a lot of criticism directed toward the governor that this was being overplayed and overstated. Well, clearly history has shown that's not been the case. We're still suffering at significant levels, and those levels will likely grow. But overall, the decisive action that was taken was quite good. Here's a criticism, if I may offer. I used to serve on the Fresno County Board of Supervisors, and we had a variety of emergency preparedness plans, one of which included surge capacity and whether Fresno Fairgrounds could have been used to expand the infrastructure that we would need. Now, we know that we have a lot to be grateful for in terms of some of the health core the health core provisions that will allow more healthcare professionals into our system. But I had a conversation with Republican leader Kevin McCarthy, and we couldn't quite figure it out why the state of California rejected Fresno's location, the fairgrounds, for this type of facility. My understanding is that it was based that there was code violations and it didn't satisfy the needs, even though on paper it had been in existence for some time. So in my conversation with Leader McCarthy, we found out that the Department of Defense, the U.S. Department of Defense, would have to weigh in on this. My understanding now is that Fresno County is now looking at alternative locations, the Selland Arena and others, because we can't waste any more time. So the criticism is that we had an emergency preparedness plan that actually did not match up with the standards and needs of the time. So moving back to the governor, the Health Corps program that is inviting folks who have retired and those who are part-time or not practicing, and those who are students, inviting all of those. And my understanding is that we have almost 70,000 folks, including Dr. Arambula, who have volunteered to make themselves available to meet the surge capacity. So I think it's a mixed bag, but overall, California is doing well.
And if I can add on, Tad, I would just say we need 50,000 more hospital beds at a minimum. The governor, that's for phase one. People are talking more beds for later on. The governor came out with different numbers. So I think we need an all of the above strategy that helps us to increase our capacity. And we should be figuring out how we make sure we get 250 beds at a minimum increased here in our community. And I plan on working with our local hospitals to figure out how we can partner and make sure we're being effective and efficient. But really do think that we are up to this challenge and look forward to engaging with our partners on it. I can tell you I engaged the administration on Tuesday, specifically regarding the issue that Senator Borges brought up, and do think that my call tomorrow will help to shed some light on what their decision-making is and how we can make sure it works and functions for our community, and that we can meet that 50,000 bed need that we have for our state.
Okay, thank you.
All right, so I will ask the next question, and this one's going to go to our educators. And the first part, we're going to go with higher education. And the question is, how is distance learning working out at Fresno State and at Fresno City College and in the community colleges in our region? And how do you expect that there will be any lasting changes as a result of what's happening today with distance learning? So let's start out with Dr. Castro.
Sure. Well, first of all, I'd say that it was done so quickly for us. You know, over a few days, we transitioned from where we were to going virtual. And I don't use online education to describe this, because there's a whole process by which we had online courses with professional development. And in this case, all of that was accelerated over a few days to get to where we're at. We have certainly learned a lot. Our team has been heroic in preparing our faculty to do this. We've essentially taken almost 30,000 people off the campus at this point for safety reasons. And I would say our students have been heroic as well, because throughout this whole period of time, many of them have lost their jobs with the schools closing, their children at home, so they have to balance watching their children with sometimes economic distress. So while we've tried to do everything we can to prepare them for virtual education, giving away technology for them, mobile hotspots, all of that, making sure they're getting fed through our cupboard. It has just been a very anxious time for a lot of people. Having said that, it's generally working pretty well. And what I would say is that we're not going to go back to where we were. We're going to go to a new place, and I think an exciting place, because I think many of our faculty and our students are going to find value in some aspects of this. So I would anticipate that we'll do much more of this in the future, and it'll be more grassroots. I think we'll see more faculty who say, I'd like more of my courses to be done this way. And students will say the same, because it does offer flexibility and it does offer greater access to folks who might be in rural areas who can't get to Fresno on a regular basis. So I do see a silver lining from that perspective from all of this.
Dr. Castro, if I could jump in real quick.
Sure.
Do you think that this experience with the distance learning would allow you to increase your enrollment?
Well, potentially, yes. In the short term, I'm very concerned about the economic distress this is all causing some of our students. And I want to make sure, first of all, that we're able to retain the students that we're serving now. I don't want to see them dropping out. And so far, I'm not seeing any evidence of major changes from a year ago to today. So that's encouraging. But yes, I think there are ways in which we could better serve students throughout the San Joaquin Valley through virtual education, as long as the quality can be maintained. And I do think that that can happen over time. We'll be able to enhance the delivery of education and tap into new technologies to make that better.
Dr. Goldsmith, talk about this at Fresno City College. How has this changed education there? And do you see any lasting changes that result after this?
You know, absolutely. You know, Fresno City College is the first California community college, but there's 115 other colleges throughout the state serving approximately over 2 million students. So the Herculean efforts that are occurring across the state really is kind of overwhelming. And just to give some examples, at Fresno City College alone, we had close to 2,800 active courses or sections. And pre the crisis, we only had about probably roughly 300 or 400 online remote offerings. Right now, we have over 2,500 sections now offered through remote education opportunities. So that's a Herculean task. This migration to this new remote reality has been really a stress on the system. But I have to say, our faculty and staff have been amazing in terms of their dedication, working tirelessly to migrate their content to this new platform. And I want to remind everybody that not everybody has taught online before, nor as 60% of our students have not taken an online class before. So we're all learning this together, and we're learning new skills together. And I think while some of our faculty may not have taught online, they're still content experts, and they're experts in their field. You know, we train and educate the vast majority of the Valley's first responders, our nurses, 110 getting ready to graduate in May, another 110 in December, and 230 behind them. Our pipeline is large, and we have to make sure that our police and fire and EMT and paramedic, respiratory care, rad tech, construction, and the whole host of the other 30,000 students that are just at my college alone. But think about that at Clovis and at Reedley and at Madera and all up and down this great valley. So our migration was swift. In fact, some of you may recall the story that the Fresno Bee ran. Fresno City College is one of the first that had to shelter in place quickly, because on Monday, March 16th, we decided, out of a preponderance of caution for our students, because we had a COVID-19 scare, we closed our school down. So those 4 days that we were going to have, thankfully our board on March 13th agreed and gave the chancellor emergency powers so we could go online and take those 4 days to train. We did all that training remotely. So I need to have a big shout out to the faculty and staff at Fresno City College who left work early on Monday, grab and went. And we've been in triage and emergency state since, and they have done an amazing job. And we continue to have our first responders classes still continuing. We continue to have our counselors and faculty check in with our students. In fact, we took last week, we called it a humanitarian week, so we could make sure that people would touch in, check in on people, check and see how the new platform's working, and have a little grace with one another, have a little patience, and just check in to see how they're doing, because we know that a lot of people have been impacted personally by this pandemic. You know, some of us used to joke before about wouldn't it be nice to work from home? Well, it's different because we're working in the middle of a pandemic and a national emergency. And so we have done some amazing things. One of the things that has become apparent is that a lot of people, I do think, like this online remote ability. We want to be trained a little bit more, but we never could imagine how many of our students didn't have the essential tools that they needed to be successful. So much like Dr. Castro and many of my colleagues up and down the state and our K-12 partners, we're working hard to get devices into students' hands so they can access education and continue. And so I'm very proud of the efforts and many of our community partners who have helped us do that. I'm overwhelmed by the collaborative nature that I've seen throughout our community. And I hope that will continue long after this pandemic is over and we go back to normal.
Thank you, Dr. Goldsmith. So now let's switch to K-12 education. And Dr. O'Farrell, how is distance learning going in Clovis Unified? And does every student now have access to a computer to get their work done?
Well, thank you, Joe. I would say, just much like my colleagues, we had a very swift migration, as Joe Castro put it. But what I'll tell you is distance learning is quite a broad term that we're using right now to educate our students, because distance learning is not just about using a computer or virtual lessons. It's about engaging our students. It's about supporting them through various different platforms. Our teachers have been using, honestly, a lot of our teachers have been using the telephone to connect with our kids. What I'll say is we've been more aware than ever of the importance of paying attention to not only the academic well-being of our kids, but just all of the other, we're talking about younger kids as well. So just paying a lot of attention to the anxiety, the loneliness, their world has been turned upside down. As you know, young kids are very social beings. So distance learning has taken on various forms in our district. At the beginning of this, when the executive order came out on March 13th, we did a survey immediately that week, we did a survey of every single family, every single student in every classroom in our district to ask our parents what was going to be the best and most efficient way for them to participate in education. And some of our students chose a digital platform. Others wanted more independent study packets, and many opted for a hybrid of both. Many of our families who have access to digital platforms equally have 5 children in their family, and they want to be able to sit them around the kitchen table and be able to monitor them. So we've been engaging in a wide variety of ways to reach our kids. But what I'll say is that we've been distributing, we're distributing devices. We're also distributing hotspots, talking about filtering hotspots, that kind of thing. And we're also working very closely with Jim Uvino, our county superintendent. There are 32 K-12 school districts in Fresno County. We're just one of them. And Jim Uvino is one of 58 county superintendents around the state. So he's in constant contact with Tony Thurmond, our state superintendent of public instruction. And he's been a great conduit for us as county superintendents to make sure that we're participating in any support that's coming from the state. And one of those supports has been in the area of technology. So we've been surveying our families, deciding on how many devices need to be distributed, hotspots, that kind of thing, but there is actually more support coming from the state. So it's a very broad term. Even with little kids doing little things like our teachers have been engaging in parades in their cars through the neighborhoods with posters and balloons, because young kids need more than just to participate in a Zoom session like we are right now. They need that encouragement and that hope and that connection. And what I'll tell you, what we've learned is that our kids are missing the interaction. That we're able to stay on top of the content. We're being very intentional in our content. We're focusing on mastery standards, essential standards. All of our teachers are doing like Carol said, Herculean work. There's amazing planning going on. We've been integrating technology in our educational, instructional programs for years now. We have an entire team of technology teachers on special assignments who have been working day and night now. But many teachers are using it much more than they ever have before. But even with all of that, what we recognize is that you cannot usurp the power of human interaction, especially with younger kids. I'm talking mainly with elementary, intermediate school, even high school. So high school kids who I often say are little kids in bigger bodies. They really are missing that interaction. And so if you ask me, is this the way of the future? I would say it's not the answer totally. I think as human beings, our kids are very social and they need that interaction. They're missing it right now.
Thank you, Dr. O'Farrell. So next, I know there are many people who have joined us via Facebook, and a lot of them are sending questions. And so Isabel Diepa from the Bees Education Lab has been looking through those questions, and she's going to ask one of them right now. So Isabel, over to you.
Thanks, Joe. Hi, everyone. This question is from Michael Rayos Maldonado, and it's a question for Joseph Castro and Carol Goldsmith from a Fresno State student. And the question goes, given Governor Newsom's announcements about the school closure in California, what is the likelihood that Fresno City and Fresno State's fall semester will also be only virtual instruction? If so, will there be any adjustments made to students' tuition costs to account for the changes?
I'll speak on behalf of Fresno State. It's hard to tell what's going to happen this fall. We have made a decision about the summer. The summer will be done virtually. And so if he's going to be taking courses with us this summer, then we would be continuing in this mode. At this point, we're hopeful that we can return to the way that we started this semester, but we won't know for sure until we get out there a few more weeks and have a chance to assess the situation. Our health friends have said to me that there's a possibility of this returning in some way later in the fall. So we would have to consider all the advice from our public health professionals and, of course, what the governor would ask us to do as well.
Yeah, and similarly, we've been in constant contact with our state chancellor, Eli Oakley, and very similar to Fresno State, we are going to have an online program this summer. And it's hard to tell what we're going to do. I've had some meetings with the faculty leadership and admin leadership to look at the possibility of us having another remote semester. What would that look like? So while we're planning for a normal fall, we also, in the back of our mind, we're also being problematic and good stewards of the great possibility that we might not be. And I have a feeling that we're going to be publishing our enrollment. In fact, we're going to be enrolling later this month, April 15th, for the fall. So we do have face-to-face openings. There'll be a caveat on there that this may be subject to change. And so our faculty now are working on what would that look like if that should happen. The good news is we've done that migration. And so we're preparing for that without the guidance given from our state chancellor and our local chancellor. That's all we can do right now is just continue to hope for the best, but plan for plan B. And wherever you decide to go, I want to encourage that person to make sure they do enroll at Fresno City, Clovis College, Fresno State. Continue in your education because we need you to continue on in your education. Doesn't make a difference where you go, you just need to go. So I hope that answers your question.
Thank you, Isabel, and thank you, Dr. Goldsmith and Dr. Castro. Now I'm going to turn it over to Tad, and he's going to ask our next question.
Okay, thanks, Joe. We're going to bring it back to our elected leaders and come back to some of the medical challenges facing the state with the pandemic. So as you both have referenced, experts are predicting the surge of cases in California is going to continue to ramp up. So how well prepared do you feel the hospitals are in your districts? And how about nursing homes and assisted living centers? And what are you doing specifically to help those entities? Senator Borges?
Would you like me to start? Well, I don't think that we are adequately prepared, if we're being honest, because I think something of this nature and size has rarely been anticipated. Doesn't mean we cannot rise to the challenge, however. We are Americans, we're Californians, we can do this. We need to make certain that we use a whole of government approach. And I think that's been referenced on a few occasions on why that's important. Federal authorities need to chat with state authorities, and state authorities need to chat with local authorities. And in that continuum of exchange, we understand what is happening. And let me give you an example that I've seen recently, that the state of California may be trying to procure resources and materials from overseas or elsewhere in the country. After talking with Governor Newsom and others, I'm wondering if there needs to also be a national directive that we coordinate our procurement process. That I think could be terribly helpful in this very unique period of time, leveraging our resources as a country to obtain the needed materials and in an expeditious manner. I think it's clear, though, that the surge capacity that we're going to experience is going to overwhelm our existing infrastructure. So we need to make certain that we reduce red tape wherever possible, be as flexible and nimble as possible. As I mentioned before, when Governor Newsom put forward the health corps, the idea of bringing in individuals with medical backgrounds, maybe they're not completely licensed, or maybe they're retired, or maybe they're part-time or not practicing, allowing them into the system. And we heard from Dr. Rambula earlier that we need so much more, especially in the Valley. We are in acute need. Our asthma rate amongst youngsters makes us vulnerable. Our ratio, I think the ratio that we've talked about is that the Valley has an average of 157 medical personnel to 100,000 people, compared to the rest of California that is around 288. So what we've done through that whole of government approach, I've signed on to letters with other members of the Valley delegation, including at the national level, to the respective leaders, in particular Governor Newsom, asking him to look at our unique vulnerabilities and create a liaison officer for Valley needs, as well as additional resources. So if we have a national procurement agenda, as well as prioritizing some of our Central Valley needs, that will go a long, long way.
So I'll jump in and say I've been quite involved in trying to have discussions with local facilities. My office has had conference calls with CRMC and Kaiser this week, and plan on reaching out to many other facilities, as well as coordinating with the Department of Public Health and, as I previously mentioned, Cal OES. But I think we have been preparing, and by preparing, I mean we've been decreasing elective surgeries, decreasing hospitalizations in anticipation that these beds will be necessary. We also have been procuring and testing of ventilators to help us with the next stage of this. And I think we do need to see this as phases. And so, you know, I'll add a little bit of a perspective, though, if I can, to this pandemic, and just share that I've been through 5 of them already. And we have not given them the same attention because they might not have the same disease and transmission and mortality of the others. But we've had SARS and MERS and H1N1 and the avian flu and swine flu. And now we have COVID-19. And our systems do have plans in place for us to deal with pandemics. And we have prepared for this. But areas that are historically overburdened and under-resourced like ours have to be very cognizant of our surge capacity. We have the ability to overwhelm our system if we don't take the practices that are being, and the guidelines that are being put before everyone right now. And I would just, if I could, I'd brag a little bit about our local hospitals. I'm proud of many of them. And our level 1 trauma center that we have in downtown Fresno is also, from what I've heard, the busiest trauma ER we have in the state of California. And I think we have tremendous resources in our community that will allow us to stay safe during this pandemic. We just need to figure out how to support them and to listen to them. Most of what I'm planning on doing over the next week to 2 is really to talk with those who are on the front lines. Hear from them about what their needs are. Is it personal protective equipment? Is it ventilators? Is it something that we're not considering now, so that we can help them to procure it and prepare for this pandemic will allow us to be in a better position going forward. And I look forward to working with all the partners to figure out what our needs are as a community.
Thank you. All right, our next question is going to go to our educators, and we've kind of already answered some of this, but I want to ask it again because it's so important. Is it inevitable that students in the current grade levels in college and in K through 12 education are essentially going to miss out on key learning this spring? And we could start with Dr. O'Farrell.
Sorry. Yes, the question about are they going to miss out on key learnings? And what I will tell you is that our approach has been very strategic in that our teaching teams across our district are focusing on what we call mastery standards or essential standards. And in the way our K-12 system is structured is there's articulation, especially at the elementary level, between each grade level. For example, there are certain mastery standards that a 5th grader needs in order to enter into 6th grade successfully. And so our teams have been meeting to determine at each site level. We have what we call site-based management in our district. And what they're doing is focusing on those mastery standards and actually also meeting with the grade level below them and above them to make sure that our kids are, to give them the maximum opportunity to be successful going into the next grade level. In addition, at any time, pandemic or not, as students are entering the next grade level or entering any grade level within our system, we have students coming from outside of the district, moving within schools within the district or districts in the county, and we have students who's, who have what we call summer regression, where they forget some of the knowledge over the summer. So every fall we engage, and I know that all of our school districts in the K-12 system, we engage in assessing our students, analyzing deficiencies, intervening in their learning. I will tell you that we're anticipating that we'll have to engage in more intervention, more review at the beginning of this upcoming school year. But it's not something that is overwhelming. We feel quite confident about doing that. I will say that we've been very strategic in our distance learning. We're maximizing every resource we have right now. Our intervention teachers, our instructional aides, our bilingual aides, our counselors, our student relations liaison. We have transition teams. Everybody is involved in making sure that as students, any students who are struggling academically, they are getting that help. So we've encouraged parents to connect with their school principals if their children are struggling, and making sure we have a lot of people who are available to help. So we're not waiting till the fall, we're giving it our absolute best right now.
Dr. Castro, what do you think?
Well, I think that everything about our lives right now is very different. And the way in which our courses are operating right now, I think are at the highest level possible. We have the same great faculty who are involved in these courses, the same great students. The difference I see is that this is a very stressful time, and we've encouraged our faculty to be flexible and compassionate and understanding. And so some of these class sessions might be about how students are managing to get through from day to day. And then they get to the actual content of the course. And in my opinion, that's okay. And that enables our faculty to assess where our students are, and if they need counseling services, they can be referred to those. And we have all the range of supports still in place. They're just being offered in a different way. And so I think that everything about this semester is going to be different. The way that we handle grading is going to be different. Our provost will communicate this to our students tomorrow. And it's a way of lessening the pressure on everybody and just focus on teaching and learning the best we can, knowing that the whole world is just changing so quickly. And I think that that's the most important thing that we can do right now, is to support our students, and especially the ones that are so close to the finish line. Some people say, well, why don't you just shut down? Why would we do that and take the opportunity away from our students who want to continue to learn and progress? And our state needs those graduates. Our valley needs those graduates to help strengthen the economy, not just in the health sector. A lot of our students are helping right now during this crisis, but I'd say in all sectors. So yes, it's different, but I believe that it's still high quality, and I believe our students are learning a lot, and they're going to be served well.
Dr. Goldsmith, do you have anything to add?
Sure. In addition to the comments, and I agree 100% with my two esteemed colleagues, I think it's really important to note that our nation has not dealt with a crisis like this on this level. And matter of fact, many of our students were not alive when 9/11 happened. But even that, the United Nations just came out with the statistic that 90% of the entire planet's student body is dealing with this crisis and having to do remote learning. So you've heard through my comments and my colleagues' comments about the efforts of our dedicated and talented staff and faculty. And, all of us are continuing to have robust programs online, and the content is going to remain the same because those talented faculty members are being compassionate and are offering humanitarian efforts, in addition to making sure that classes stay rigorous. So one of the things I want to really stress is that the rigor hasn't changed because the format is no longer on ground or face-to-face. I think it's important that our students have an obligation to our society to stay with us, to hang in there with us, to don't give up, to keep coming to class, to stay engaged. We're here for you. As you've heard, we've put a lot of our services online. That's because we want you to stay engaged, because we know our workforce needs you, whether you're a first responder or you're getting ready to transfer to Fresno State. We need you to stay engaged. So all those students who are listening, I'm asking you as a moral obligation to yourself and to our community, please stay engaged. We know that we can do this together. And that's all I'm going to say, is that I know we can get through this.
Thank you. At this point, we're under 15 minutes left, and we want to also open this up again to see what other questions we're having from our audience. And I know Isabel's been spinning the dials and working on that. So Isabel, the floor is yours to ask a question from the audience.
Excellent. Thank you so much. So this next question is from Aurelio Rubio Jr. And it's, will the city be able to allocate funds for anti-recidivism programs and or job assistance programs?
So I don't know if we have anybody from the city on the call, but maybe our two legislators have something to say about that.
Certainly, I'm not fully briefed on the programs that the city has started or is still considering, but I am aware that there are a number of grant programs. You have the state program, the CalCap program, which is designed to provide up to 100% coverage on losses on loan defaults. The city of Fresno, I believe, has $750,000 allocated for small loan to dole out small loans to businesses to get through this process. I think all the instruments of government are at play right now. So there's going to be a lot of parallel and complementary funding sources, whether it be through the CARES Act at the federal level or the CalCap at the state level, as well as the city of Fresno through its loan program as well.
You know, I'll jump in as well. I do think that's a local municipality question and would encourage our city leaders to get involved with it. But do want to point to the CARES Act at the national level, as I do believe that today or tomorrow is actually the first day that small businesses can apply for those loans. But there is an economic injury disaster loan up to $2 million that our small businesses can apply for, as well as a loan advance of $10,000 that's included within the CARES package. And I think that's a significant way that our small businesses can help to make sure that they stay afloat during this time, and believe that the state should have some responsibility as well to align ourselves with the federal package. And we'll be working with my colleagues to see if we can do that. But I would be remiss not to mention some of the work that was actually done today by Governor Newsom. And yesterday I was lamenting that the federal package didn't work for all of my community. And sometimes I'd rather be transparent about what it is exactly that I'm saying. But many of our undocumented community are unable to receive relief from the federal stimulus package and are unable to apply for small business support during this time. The governor today put in $50 million for microloans for businesses that are not eligible through the Small Business Administration or through federal relief, as well as $10 million for small businesses and nonprofits to help to pay workers during this pandemic. It's important that our workers, those who are employed right now, are able to retain their insurance, and helping to keep some of those small businesses and nonprofits stable through this pandemic will be more beneficial for us as a state.
Thank you. I know we're winding down on time. So Isabel, do you have another question from the audience? Give them a chance to ask another one.
Yes, this one is actually concerning for Clovis in regards to Clovis Unified Seniors. Many of them are wondering how are GPAs calculated, since there's still uncertainty about the year being completed, and will summer school still be in place, and if so, how?
Just yesterday, the California Department of Education issued guidelines regarding UC and CSU grading and admissions criteria. And to that end, our team here in Clovis Unified met this morning to discuss how we were going to approach grading. So what I will tell you, and I'd like to piggyback on what Dr. Goldsmith said, because she used the word grace, and it's a word we used a lot today too, is that we recognize that this is very unprecedented times. And we want to make sure that our students are held harmless to a grade that they had back in the beginning of March, if they are prepared to try to improve their grades. And so we've been looking at ways that ultimately serve our students the best, and also give them an opportunity to be able to have a competitive GPA. And it's not just seniors we're talking about, but juniors also are very involved in this, and sophomores who potentially are taking AP classes as well. So there was a very robust conversation today, and it's not over. I know that there's a further discussion taking place tomorrow and on Monday, or tomorrow when we come back from spring break, with a goal to having a system in place that essentially puts the needs of our students at the very forefront. And what I'll tell you is what the message we have given all of our students from the outcome is that every assignment and every all the work that our teachers are assigning does count. So while I don't really want to comment on what the ultimate outcome of those discussions will be, what I'll say is they will be aligned to the guidelines that we just received from the state, but also we are seeking to make sure that every opportunity is afforded to students to improve a grade if they want to do that. And I forget, what was the second part of your question? Summer school. You asked about summer school. Yes, we would like to implement summer school again, as we do every summer. It will depend, to be honest with you, Isabel, on what the guidelines are from the state regarding state shelter in place and things like that. But we have operated summer school for many years with independent study and online platforms. So there's quite a lot we can do with summer school still that we think will be very possible. And we are very much in favor of operating summer school because it will help to bridge the gap of some of the deficiencies in learning that will ultimately have occurred because of the pandemic.
Thank you. Okay, Tad is going to ask our last question. We're at about 5 minutes left. So Tad, go for it.
Okay, panelists, we so appreciate you being with us today. And as Joe said at the start, we've invited you because you're key leaders here in the Central San Joaquin Valley. So as key leaders, as you're out and about, you're encountering people with a lot of fear growing now, not only a health fear, but the economic fear of a recession that many economists are saying we're inevitably heading to. So succinctly, how do you respond to people who say, I'm afraid of the future, I'm afraid of the current time? What do you tell them? Senator Borges?
Thank you. I have 3 elderly parents in my family, one of whom is 90, another having serious health issues. And I have 2 elementary school children at home now, no longer in school. These are strange, concerning, and scary times. When I interact with folks, whether it's at the supermarket or just walking across on opposite sides of the street, I encounter folks that want to talk about what is our state of affairs? Where's this going? And I think I have viewed my role principally as being a conduit, making certain that I'm able to provide information, because what happens, especially in partisan atmospheres, whether it be Sacramento or Washington, messages can be skewed. And what I have viewed my role as being a conduit is making certain that people get reliable, trustworthy, primary sourced information, and not getting it from Facebook necessarily, not getting it from social platforms necessarily, but making certain that the information that you're taking in is not inflaming a delicate situation more than it needs to be, or downgrading it more than it should be. So I think we have put forward out of the gate a website with a list of all the primary sources that you could imagine as they come in, and we update them regularly to make certain that people know that they can go to a site and I will direct them to a reliable source. When I say primary sources, I mean government departments, not talking heads, not speculative theorists and conspiracy ideas. So from my vantage point, my message to my constituency is make certain you get the facts and listen to the health experts. Take these recommendations and directives in some instances seriously. It will be better for us in the long term, painful in the short term, but better in the long term. Listen to the experts and act accordingly.
So I'll jump in. I think your question is what we tell people who have fear now. And I think the simplest way I'd tell them is I'm so pleased to be here in the great state of California. We have real leadership through our governor, through Dr. Ghali, to who's head of HHS, to Dr. Angel, who's the head of our public health for the state of California, who have been on the front lines helping to direct us as a state so that we can bend that curve as is directed and important for public health. I would just say that we have a bit of a moral responsibility and hope that we're not out running into each other that often, that we are actually practicing social distancing as a way for us to ensure the safety of our community, of our frontline workers, of our grandparents and parents and our kids. And as was stated by my colleague, bipartisanship is something that oftentimes does come between us. And this COVID-19 seems to be something that we can all rally behind and realize that it is about the red, white, and blue and not about red and blue here. And I'm pleased that Senator Borges was able to join us here today to be able to make sure we provide balance as well as recognize that science is important and citing primary sources is important. And do appreciate the insights that he has provided and hope that answers your question, and wanted to thank the panel for holding this forum for our community.
Dr. Castro?
Sure. Well, thank you again for inviting me. And I just want to applaud the bipartisan approach of our two elected officials. I think highly of both of them, and they serve our Central Valley so well, and honored to be with these educators as well, who do such a great job. I think what I have found is that through this fear, and even though we're not all together at Fresno State, we're actually closer together than we've ever been. And I feel that with our students especially. They are reaching out to me in ways that I have not seen before. And a lot of it is on social media. And they'll send me direct messages and they'll ask me questions and they'll ask for my advice. And I make sure that we get them the answers. And I think that's the best that we can do right now for our entire community here at Fresno State, is to help to lower that stress level by giving them the guidance that they need to make good decisions. And I think I'll end by saying we also are being good partners and doing whatever we can through our facilities to support the public health department here in Fresno County, and also the different health systems who've approached us in the event they might need access to our facilities to help during this time. And we will do our part to support the community in that way. Thank you.
Dr. Goldsmith.
Well, first of all, thank you to our two legislators who are really demonstrating what good leadership looks like. And I'm really proud that you're both representing our valley, and you're doing so with honor and grace. And you are both role models for so many of our young people watching today. Please keep that up. For everybody else, I want to thank Dr. Castro and the Bee, and of course, my esteemed colleague in Clovis. You know, I hope what you're hearing now, for people who may be hopeless, a lot of people are coming together, and a lot of people are deciding, how can we work together? We're seeing faculty and teachers and students create new PPE and donate things. I know many of our students have been involved in those efforts of creating masks, making masks. Our colleges have gathered disinfectant and other type of materials that our hospitals need. And we stand ready to lean into this crisis together. And we'll be here after the crisis too. You know, we've been serving Fresno and the Valley for over 100 years, and I plan to be, not me personally be here 100 years, but this institution will be here, and we'll be here ready for you. We encourage you to keep going to school, stay focused. I know this is kind of a dark time, but 3 words we've been focusing on at Fresno. That's care, care for one another, care for yourself. Take courage to stay at home. Take courage to, call people that you haven't called and check on them. And then, of course, compassion. We all need to treat each other with more compassion. We could take those 3 ideals into our new normal. We'll be a much better, stronger community because of it. So thank you, Fresno Bee, for having us. Everybody at State Center Community College is grateful, and we stand ready to help our valley and our residents and our state. Thank you.
That's great. And Emer.
I'll just finish up by saying, our theme in Clovis Unified is to inspire. And I see my role as a leader to inspire positivity among our students. They're looking to all of us. They're looking to me, to Dr. Goldsmith, Dr. Castro, our esteemed elected leaders. And, just listening to all of you speaking today is inspiring to me, because our community needs leaders like this who our young people can look up to, especially at a time right now, like now. And I just know that by being strong and by being positive, we play a huge role in helping our community navigate this pandemic from all of our different vantage points. And for me personally, as I've mentioned several times, I'm representing 43,000 young people who are feeling very anxious, very lost. Their world is turned upside down, and for many of them, they're looking to the school system for that stability. So I would like to give a shout out to all of my superintendents in Fresno County, because we have become very close during this time too. We're in a group text that I've been texting them more in the last 3 weeks than I have in 3 years. And Jim Yavino, our county superintendent, has been just stoic in leading us superintendents and guiding us to wise decisions, and being a great conduit for us to the state and the resources that are coming down from the state. So, there are a lot of silver linings in this. And but the main thing that I'd like to finish with is saying how important it is for us leaders, and Fresno Bee too. I thank you for this opportunity just to spread some positivity right now, which we all need.
Thank you, Emer. Wow, what a great discussion we've had today. I am so happy to have all of you here. It really is a hopeful discussion because there's a lot of thoughtful leadership happening here. And there's also hope for solving this crisis. And I think we've talked a lot about some of the ways that we could kind of get through this as a community. And that's something that those of us here at the Bee really take seriously. And we want to make sure that we are providing this forum so we could have this discussion. And we hope to do this again really soon, hopefully next week. And some of you may be involved, and I might be trying to figure out how we could extend it into other areas, and to also work a little bit with the format. I do have Isabel wanted to make one quick plug for something that she's doing tomorrow, and I'll let her do that now. So take it away, Isabel.
Thanks, Joe. Thank you everyone on the Facebook Live who stayed and is currently leaving comments. I just wanted to invite you all back tomorrow morning at 10 a.m. I will be hosting a live with my K through 12 reporter from our Ed Lab, Monica Velez. We'll be speaking to Tracy Edmonds, who is a curriculum specialist, to help give best practices on what you can do in order to be able to do some work from home with your kids, and also give some advice, and also talk about some goodies and some curriculums that she has developed. So that's going to be a really fun conversation and some really good advice, hopefully. Thank you.
Thank you, Isabel. Thank you. And thank you so much for attending, all of you. It's been a great discussion. And again, that key, of course, is on the hope that we have to get through this all together. And we live in a country that put a man on the moon. We could certainly tackle COVID-19. So thanks, everybody. And we're hopeful to do this again really soon. But thanks for attending, and thanks for watching. Bye.
Thank you.
Yeah.
Thank you.
Thanks.
Everybody.
Thank you.
Thank you.